Hey everybody, this is Linda from Linda Takes It Back. I just wanted to give you an update on what's been going on and tell you a little bit about my pre-op process. Let me start out with my stats. I don't think I've ever given them before. I am looking to have VSG surgery and I'm trying to get qualified. And right now my weight is 215.6, I think, when they weighed me in for my first consultation. And I am 5'3.5". So that puts my BMI, I think, at around 38 for now. And so the reason I'm looking to have the surgery is because I have chronic pain from osteoarthritis. I have joint inflammation, and I'm sure there's a lot of other factors too, but I feel that getting the weight off is really going to help with a lot of the inflammation and pain that I've going on. So that's not a standard comorbidity, and it's going to be a bit challenging for me to get approved. And as I tell you about my pre-op process so far, you're going to see how challenging it is. So I'm going to go ahead and just start with the story, and maybe this will help you in your own journey. So about, how long ago was it? 4 or 5 months ago. I know in June is when I started thinking about it. A friend of mine had had the VSG surgery and it was having dramatic results for her, and I was amazed, and I hadn't heard of gastric sleeve compared to gastric bypass. And when I researched it, I was amazed at the difference in it, how it doesn't reroute your intestines, how it doesn't seem as invasive, and the results that she was getting. So I started to look into it, and I did contact a surgery center near me. I had gone actually to that medical center before for a rheumatologist, so I was aware of where it was and everything. I did the info session online, I watched it, and then I made a consultation appointment. So I was really, really excited because I thought if they took my appointment, they also had me fill out like 13 pages of forms. So I was pretty much thinking they're going to help me with insurance, and they're going to help me and tell me how I can figure out how to get approved for this. I did also go to my insurance site and make sure they do cover bariatric surgery, and I did have a basic idea of what they covered. So when I went in for the appointment, I can't say I had a great experience. It wasn't what I thought it would be. They weighed me and they took my measurements. They measured my neck, which no one's ever measured my neck before, and weighed me, and then took my picture and asked me a lot of questions, and that was just the nurse. Then I waited a long time and the doctor came in. He didn't really seem very engaged. He didn't really seem very personable. And when I talked about my condition, he just kind of was like, well, you're going to have to see if insurance covers that. And I was kind of upset because I thought that's what I'm here for. I thought that I'd be meeting a team of people and they would talk to me about that. But he kind of just brushed me off, and that was the end of the appointment. So I never learned about what their team would be like. I never learned anything that they had to offer, and I was sent back home to call my insurance company on my own. And I may have mentioned this in other videos, but I kind of want to give the whole pre-op story to you. So I went home, and well, one, I was really upset when I left, and also they wanted a $200 fee to get you started. So if I did get an approval from my insurance company that they do cover that comorbidity, I would have to pay $200 without knowing anything about their program. So I just didn't get a good vibe from it, and I went on and I went home and I spent like several hours on the phone with my insurance company, and they were bouncing me from one department to the next department. And even when I made it to the bariatric approval department, they wouldn't tell me if they covered, at the time I thought I had ankylosing spondylitis. And so that's a back condition and that causes a lot of pain. So they wouldn't tell me if they covered that or not. And the one person did say, you're not the one who should be calling. Your doctor's office should be calling with a code of your comorbidity. And I was like, Eureka! That's what I thought the whole time. And anyway, so I just was very frustrated and moved on from there. So I didn't want to give up. So I found another info session near me, and I also had told my mom about it, and she was a little like leery. She didn't quite know about the surgery and what it was like. So I said, well, why don't you come with me to the session? And that's the one I talked about in my other video where I actually ran into somebody I went to high school with. And I was like, oh it's crazy. Anyway, so I went to that session, and that session was interesting because they did give me a lot more information at the info session, but they also said some strange things like they make you sign a form because 75% of relationships break up after bariatric surgery, and they wanted you to be aware. Like, in general, there was like some negative things to kind of try to scare you off, and it was a little odd. But in general, I liked the doctor, and I liked the center, even though I really didn't get to see the offices or anything. And that was one thing I didn't mention about the first office. It was a little dated. It was a lot dated, and I was kind of surprised because I had been to other offices in that medical center that were very nice and very modern. And so I was like, are they not making a lot of money, or do they just not fix up their offices, or what? So with the second place, I never even saw their office because this was in a conference room. So I did fill out another 12 pages of forms, and I sent them in thinking I would be able to get an appointment. But when they called me, they said, if you don't know if you have hypertension, diabetes, or sleep apnea, then we won't even schedule the appointment because we won't get reimbursed. And I was like, that wasn't true because I just did an appointment with somebody else. Anyway, they just didn't want to waste their time or work with people who were outside the normal comorbidities. So I went and had a sleep apnea test, as I talked about, and I was negative for that. So that's like all these strikes, and I didn't want to give up. And I called my insurance company again, and I said, I have osteoarthritis, because I went to a new rheumatologist, and he says, you don't have ankylosing spondylitis, you have fibromyalgia and osteoarthritis. It shows on your MRI and in your knee and all this stuff. So I'm like, okay, so I've always had that. We just thought I had something different on top of that. So I called the insurance company, and I'm like, just one last time, please get somebody nice. And the person said, I said, well, what are the chances of me getting approved with osteoarthritis? And they said, oh, I don't see why not. Because it says these comorbidities, but not limited to. So you would just have to prove it and do a special case and submit it. And so I said, okay, have you actually seen this happen? And she said, yes. So I wrote down her name and got her information. So there I had hope. So I went and I found another bariatric center, one of the really, really good ones. And they are a big one in the area, and they have offshoots all around my area, even though you'd have to go way into the city. About 45 minutes to go to the hospital, you can attend all the other doctor's appointments out here. So that's really a benefit to me because I have to always be back to pick my kids up from school and drop them off. So I don't have a huge chunk of time to drive into the city all the time. So the other thing that is a great benefit of this center is that they are MBS AQIP certified. And that is an important certification that I haven't seen anybody else in the area have. Sorry about that. So I was talking about MBS AQIP certification. So I listened to this podcast called the Weight Loss Surgery Podcast, and it's by a nurse practitioner in Oregon, and her name is Rieger Cortell. And she talks some of the podcasts are like an hour long, and she talks on all different topics. And one of the ones I had just listened to was their practice. Works for a bariatric center, and they were trying to get certified for MBS AQUIP and all that they had to go through. So they had someone come in and review files with them, interview them. They examined all of their off examination rooms, their entry room, to make sure they had chairs, large chairs for overweight people. They examine their surgery operating rooms, and you have to wait like 6 months or something to hear back if you're certified or not. It was a really big deal. So I was feeling really good that they went through that whole process to bother to get certified. And I'm sure it took a lot of time, and it means a lot that they met that criteria. So I called them, and I went to the info session, and I also spoke to somebody on the phone, because this was kind of in between my call to the insurance, where I didn't know if I would be covered or not. And when I spoke to someone on the phone, they were like, well, we would take you and see if you would get qualified under that. I know it's not like a sure thing, but that they would actually work with me for the 6 months weight management that I had to do, and help me get all the qualifications, and then do whatever they could to try to get me approval. And I was like, somebody wants to help. Somebody wants to work with me. And so I set up the info session. I was going to cancel it, and then I went, because that person gave me hope that they would help, and they wouldn't just say, we only want the people who have these 3 things because we know we're going to get the surgery out of it. And they didn't ask for $200 up front. So I went to the info session, and the doctor was great. His name was Dr. Dumont, and he worked, is at Penn Bariatrics. And he gave a lot of good information that I hadn't heard before, and talked about like a triple stapling technique that they use so that they don't have hardly any leaks or any leaks, and just the standard things. By now I'd been to 3 info sessions, so I had heard a lot, and I asked a few questions. And other people, you have to raise your hand during the info sessions, because I can't be the only one. I had like 4 questions, but I only asked like 2 because I'm like, well, nobody else is raising their hand. But I took notes so that when I met with him, I could ask him. And one of the first things he said in the info session was that there are comorbidities that contribute to early death because of obesity, and they are hypertension, diabetes, sleep apnea, and osteoarthritis. Ah, crowd goes wild. He said the buzzword. I was like, yes, osteoarthritis. So maybe not to an early death, but maybe to like just obesity contributes to those. No, I guess it is comorbidity. That means, yeah, never mind. I'm rambling. So then I set up an appointment with him. And this is the difference between my first appointment and this appointment. It was night and day difference. So it started off, I got there, I got weighed. They let me leave my sneakers on. That was awesome. I was very excited about that because I need to weigh higher, obviously, for my BMI. And then I met with a dietitian. She gives me this book. Hold on. I love brochures. I get a lovely brochure. And it's got tons of information about the whole weight management program, about VSG versus gastric bypass, and changing your behaviors and what behaviors you're going to need to do after the surgery. So it was very interesting, and we're supposed to go over it during each of our weight management sessions, which I have to do 6 with my insurance. So I got to ask her questions. She asked me questions. And if you didn't notice, they did not give me a 12 or 13 page form at the info session. And I called before I went to this meeting with the doctor, and I said, don't you want me to fill out 13 pages of forms? And they said no. So, okay. So I went to the dietitian, And then after the dietitian, the nurse practitioner came in and she gave me all the labs that I was going to need for prior to surgery. So within the 6 months, I have to do an upper GI with barium swallow. That'll be great. And an GI abdomen ultrasound and an x-ray of my chest. And I also have to do an EKG with my primary care physician. I think I have to get a physical. She gave me lab work for blood work as it gets really close to the time. She said not yet. And I think that was it. But then she asked me pretty much all the questions that would have been on the 12-page form. She asked me personally, and so did the dietitian, and they were entering them as they were talking to me. And I just thought, wow, isn't that a concept? You actually ask the patient the questions directly, and you can, develop a relationship. I thought that was pretty cool. Then she said, hop up on the table, and she gave me an exam. Hey, that's an idea too. So she just checked out my C-section scar to see, where it was and how big it was and everything. And she also felt to see if my abdomen was tender. And I think that was it. So then after she left, I also got to ask her questions as well. I forget if I asked her anything. The surgeon came in after that. And he was very nice. He remembered me from the info session and just kind of gave me basics, asked me what surgery I wanted. And I said, because, I have this BMI that's not above 40, am I a good candidate for this? And he said, yes, you actually are a better candidate because you don't have these comorbidities yet. You're going to prevent them from happening. But, of course, the insurance company doesn't want to pay for all those people. They want to know something's wrong with you. So it was really good talking to him. And then when I asked him about the triple staple technique, he actually drew me what a regular staple technique is and what the triple one looks like and how it keeps leaks from happening and how they do a test during the surgery for leaks, but they don't do it afterwards, and they don't do a drain, and that they haven't needed to do a drain because they don't have leaks because of this technique. And I was like, oh, that's awesome. And so I got to ask him some things about medication, if I could continue them. He was just really easy to talk to. He didn't make me feel like he was watching the clock, trying to rush out of the room to the next person. He was very receptive to all my questions. He gave me an insurance person to speak to about trying to get me qualified and doing whatever we needed to do to get me qualified. And then at the end, he held my hands and just was like, it was nice to meet you. And it was just really nice. I just felt like he was a good person and very easy to talk to. And I had an experience with my pregnancy where my doctor, I called him Dr. Breezy because he was basically backing out of the room as you asked questions. Anything that was a concern to me, he blew off. And honestly, I almost died. So having someone who actually listens to your concerns and is personable is very important to me. And I just thought the whole experience was amazing compared to my first experience. And so go with your gut. Don't feel bad about checking out multiple bariatric centers. Ask lots of questions. If you have any, try to write them down in advance. And they can be personal questions about your own medications, anything about recovery, and it may, I asked about, things to do with my age and healing and things like that. And I'm, maybe a little older than most people getting the surgery. I don't know. But, I don't know. I was really excited that I felt I had a lot of things answered. I felt really comfortable with what was going on. And I even called with a question today and felt like I already know the people because I spoke to them twice and they remembered who I was. And that was really cool. So now I'm on my 6-month weight fest, and it's kind of torturous. So since I'm at a lower BMI, not a low BMI, obviously, I can't lose weight. If I lose weight, then the insurance company might not approve me. And I don't know what to do. So I lost 2 pounds without even trying, and that has not happened to me in 5 years. I have been stuck, and I don't know if it's just changing my behavior to the behaviors on the list, like try not to eat fast food, and maybe I'm just being more conscious of it, that I lost 2 pounds. And so it's also that I just went off a whole bunch of medications, and so that could be taking effect. Every time I would try a new medication, I would gain more weight, and I would gain 7 pounds in a month, and then it wouldn't come off. Anyway, so I have to deal with this now. I'm like, what do I go eat a burger now? I'm not really sure. So that's my challenge. But that's what's going on right now, and my next appointment isn't until November. And then I set up a bunch of my tests for this year. So I set up the x-ray and all that, and also my psychological exam for this year, because I think that's the best chance of getting it covered by insurance. So I will let you know how it goes, and I'll keep you posted. I may not be posting every week since I don't have as much going on right now, but as something happens, I'll let you know. Thank you so much for listening, and if you have any questions about your consultation or you want to share anything, please post it below. I hope you'll subscribe to keep in touch. Thanks. Bye.